This picture was taken in Aden in 2015 in an area called Khor. This area is near the airport. It was a touristic area not far from the beach. And we can see in this picture nice buildings, by the way, completely destroyed, an empty street with a tank in the middle and many debris around. When Ansar Allah, known as well as the Houthis, came from the north to the city, the governmental forces withdrew to the south, and they left the middle of the city caught in the front line with many civilians caught there as well. So we can see in this picture the atmosphere of street fights that really happened very heavily in the city at that time. The MSF hospital was opened like few years before this war, and then started to escalate its activity during this war. So the team in MSF Trauma Center mobilized very quickly, and they spent most of their time spending days and nights there managing influx of patients. On the 25th of March, only 80 patients came to the hospital, and in the next 24 hours, 180 more arrived in the emergency room. At the same time, given the intensity of the fights around the city, the team tried to move out to refer patients to the hospital, and we established some advanced medical points where we could stabilize the patient and organize by ambulance a transfer to the hospital. So there was a big mobilization, and under very heavy fightings and very regular shellings within the city nearby the hospital. This picture has been taken inside the hospital in the emergency room during a mass casualty plan. So the wounded, whether they come one by one, whether they come in groups, and sometimes it happened that we were receiving 10 or 20 patients at the same time. So the most severe patients are put on what we call the red zone, where they are ready to be operated, and the others are dispatched around where there is some space, in addition to the already existing patients inside the hospital. So this kind of situation can be very chaotic, and the team is quickly overwhelmed by the number of patients and the family or the caretakers who are also here around. So in this kind of situation, we have to find space anywhere. So patients are put sometimes on the floor, in the corridors, and in this particular time when there are fightings around, there is a high risk to have windows exploded and blast. Before we were able to put film, anti-blast film on the windows, we had to move the patients away from the window and gather them sometimes in the corridors. So the picture here shows stretcher bearers from the emergency room rushing into the hospital in a slight slope. We can see the efforts and the intensity and the urgency of this particular moment, while the patient is most probably wounded, and we are in a real emergency life-saving situation. In August 2016, there was a huge blast a few hundred meters away from the hospital that shook the whole building. And this picture was taken that day when around 60 patients arrived in emergency mode in the hospital. That explosion killed 46 people that day. So in 2016 and 17, Ansar Allah pulled out of the city and moved to the north, and the front lines were located in this area north of the city. MSF, we started what we called external activities in some areas near the front lines, like Kerash or Laudar, where we supported this advanced medical point to stabilize patients and refer them to Aden. This picture was taken in Mocha in 2018. MSF opened a field hospital on the west coast along the Red Sea. So you can see in this picture, so the structure is under tent. a little space between the bed. It's a bit congested and busy with many patients, all the beds occupied, and doctors around one particular case. So this hospital was very near the front lines and what we called an emergency field trauma hospital, a bit complementary to what Aden was doing. So Mocha was much closer to the front line, treating patients, saving lives, and referring to Aden the more complex cases. The interesting thing in Mocha is that we were receiving many kind of patients from many places around, and we were also receiving pregnant women, and we opened a maternity in a trauma hospital. That shows how bad were the public services and how little options were left to the populations. This picture shows in 2017 MSF intervention in supporting the Ministry of Health during a massive cholera outbreak that hit the whole country. WHO reported more than 150,000 cases, and MSF supported several facilities across the south of the country with around 200 beds. So it was a massive outbreak, and this picture shows MSF team together with the MOH team in Sadaka Hospital, which is just behind the trauma center, admitting patients for cholera in a specific ward that was organized for that. These cholera interventions happened during the war. It's important to remind also that in parallel the trauma center was running, some fightings were going on in the north, and we saw the start of the shift of power within the south, where STC started to take over some areas within the city, within the south. The picture here shows MSF team in Aden managing COVID. And COVID was a particular moment in Yemen. First, because it was insanely underreported and with a high incidence of cases. So the MSF team in Aden opened a COVID center in Al Amal, 20 kilometers west from Aden. 30 beds, approximately COVID center, where they admitted more than 200 patients in 3 or 4 weeks with 50% mortality. So COVID was new for the whole world, and doing big damages also among the populations in Yemen, where very little precaution measures were taken. So this new disease in this specific environment mobilized massively the team with equipment, isolation, and oxygen. We had to isolate some patients, so we had put some measures in place to protect also the healthcare workers, our staff. So we had to adapt a lot, and this had impact on our trauma center, direct impact on the trauma center in Aden. Today in Aden, we still have an emergency preparedness plan based there, progressively having a plan to pull out. But we are still monitoring, and we still have a presence in the city at this stage.